Good morning, I'm Dr. Deuk. We are streaming live spine surgery from Deuk Spine Institute. Our patient had a fusion done years ago, did fantastic, but she's developed adjacent segment disease, basically below the fusion. And what's hurting her right now are two things: the SI joint, sacroiliac joints, and the piriformis muscles. So we're going to go in and treat both. You can see some of the hardware there from her prior fusion. I think I just need to talk to my team for a moment. I think this is, wait, let me think for a second. Maybe, let me just see, shot. Gotta find the right entry point. I think that's gonna be the best spot right there. So the SI joint or sacroiliac joint connects the tailbone over to the hip bone. There's a left and a right SI joint. All of your weight of your entire body, your upper body, goes through the two SI joints and then down to the hips. So, you know, all of our weight goes through those SI joints. They can be loaded, and if they have injury to the joint, like arthritis injury, the patient's going to have horrible pain in those joints, for until you fix it. So what kind of treatments can fix SI joint pain? Basically, what fixes SI joint pain is, let's put her to sleep a little bit more, is basically, to be honest, there's only one thing that fixes SI joint pain. So that is what's called rhizotomy. That's where you kill or destroy the pain nerves to the joint. There's 5 nerves. They run from the tailbone over to the joint. All 5 have to be severed and cut permanently, which is what the Deuk plasma rhizotomy procedure does. We destroy those 5 nerves. Let's go ahead and show the audience how SI joint causes so much pain and how we treat it. Let me know.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Shot. Welcome back. We're in the process right now of basically destroying the pain nerves to the SI joint. That is the only treatment that actually works long-term for patients. We've tried other treatments like fusion of the SI joint, and a lot of doctors are going to recommend fusion of the SI joint. Don't do it. It doesn't work. There was a study this year out of, I think it was Norway, that showed that SI joint fusion does not work. That patients who had the fusion done did no better than patients who did not have fusion. So we've done SI joint fusions in the past, and our patients, a lot of them still had pain afterwards in the SI joint. We've seen hundreds of patients who had SI joint fusions still had SI joint pain. So I don't recommend fusion of the SI joint. I don't think it works. I don't recommend it anymore. We used to recommend it because we thought it worked. We were told that it works, but it doesn't. Go ahead. Yeah. Any questions?
At this moment, no current questions.
All right, we're going to move to the right side. Again, she has problems on both sides. We need to address both SI joints. Shot. Shot. When I say shot, what I'm asking for is an X-ray picture from my staff. I have a technician here who is performing these X-rays, and he's going to take a picture shot with the X-ray machine. Shot. I'm going to be moving my wand around so that I can get the wand into position where I need it to be to destroy these pain nerves that are causing her pain. Shot.
We have a question.
Perfect. We'll take
Lanu.
it.
Lanu from YouTube.
Hi, Lanu from YouTube.
These treatment and technology doesn't exist in the 18th century. How do those people lived with back pain?
Yeah, great question. So, it's quite an interesting answer. First of all, what causes back pain? Inflammation, right? But inflammation because of what? The answer is trauma. Trauma is the key to joint pain. We must have trauma to have pain. So in the 18th century, there wasn't a lot of trauma. They didn't have sports like, football, hockey, and they didn't have cars that caused you to be hurt through car accidents. They didn't have high buildings that people fell out of. So really, in the 18th century, there was far less trauma, therefore there was far less pain. But there were still people who had pain, and the way they treated it was they basically took narcotics. At that time it was heroin. They would go to an opium house and they would just smoke opium. And that's how they treated it, opium. All right, we're going to move to the piriformis release. She has torn, you guys got that leg rotated? Torn piriformis muscle on both sides, causing severe pain for her. We're going to go in there and treat that by releasing the piriformis muscle. So let's show the audience how piriformis syndrome is caused and how we treat it here at Deuk Spine successfully with our Deuk piriformis release.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You can see once you have a piriformis muscle injury, it's impossible for it to heal on its own because you have to basically stop moving. You have to lay in bed and not move at all, which is no human being can do that. We all move around in bed even. And we've developed a less invasive way of releasing the piriformis muscle. Piriformis release is a treatment that's been around for a long time, and but it's done typically open with a big incision and very painful and a very long recovery. More importantly, it doesn't work half the time. Our treatment works almost 100% of the time. And what we're doing is we're basically cutting all the scar tissue that develops after the muscle is injured. We release the muscle off the top of the hip, called the greater trochanter. I got it. And that's a permanent fix, folks. The pain never comes back once you do that. It never comes back. So if we were successful at treating the entire muscle, which I think I did, but we're using an x-ray and we're using feel, the surgeon's hands kind of feel. As long as I'm correct, which I never know 100% until the next day when the patient tells me they have no more pain. So, shot. Any questions? Shot?
At this moment,
Right
no
there.
current questions.
There, yeah. All right, good. We're going to do her right side next. So we've already completed the left piriformis release. Again, our treatment is minimally invasive. The piriformis release is an established treatment, but what's new about our treatment is the minimal invasive nature of it. We have about 8 minutes left. Shot? So, any questions from our audience?
No questions at this moment.
Thanks, Lily. You're doing a great job, Lily. Shot?
Thanks.
You're welcome. And Nikki, you're doing a great job too, despite what everyone says about you. Okay?
Thank you.
Don't let their...
Want to let you know that she passed her certification for the SPD.
Congratulations.
Just to let you know, so.
That means,
Past weekend.
means you get a pay raise, doesn't it?
I think so.
Yeah.
Sure hope so.
Congratulations.
Thank you.
How was it?
Surprisingly, a lot easier than I thought. I think I was just very prepared.
You were prepared. We prepared you.
I studied a lot,
Yeah, I'm sure you did.
read lots of books.
All right, we're just about done. Another minute or two. This surgery is minimally invasive, but it's still a bit painful. The patients always complain about pain in their back of their hip afterwards. But it's temporary. It always goes away. All right.
Sitting on, please.
We're done. Thanks for joining us. You can end the stream.